The other mechanisms listed are utilized by other antimicrobial agents. For example, all beta-lactam drugs are selective inhibitors of cell wall synthesis, and therefore active against growing bacteria. Sulfonamides are structural analogues of PABA that is necessary for folic acid synthesis. By competitive inhibition, the drug interferes with folic acid synthesis. Folic acid is an important precursor to the synthesis of nucleic acids. Quinolones are examples of antibiotics which inhibit bacterial DNA synthesis by blocking of the DNA gyrase. Antibiotics, polymyxin and colistin, and the antifungal agent amphotericin B act by inhibiting cell membrane function. The tetracyclines are a group of widely used broad-spectrum antibiotics. Antimicrobial activity of tetracyclines involves which of the following mechanisms? A. Inhibition of cell membrane function. B. Inhibition of microbial DNA gyrase. C. Inhibition of microbial protein synthesis. D. Inhibition of microbial cell wall synthesis. E. Inhibition of microbial folic acid synthesis. The tetracycline antibiotics possess a wide range of antimicrobial activity against gram-positive and gram-negative bacteria, as well as rickettsia, mycoplasma, chlamydia, ureaplasma, some atypical mycobacteria, and amoebae. These drugs are primarily bacteriostatic and act by inhibiting microbial protein synthesis. The tetracyclines, after active transport into the cell, bind to the 30S ribosomal subunit. This prevents the access of amino acyl tRNA to the acceptor site on the mRNA ribosome complex, inhibiting the addition of amino acids to the growing peptide chain. This effect is, for the most part, reversible, and removal of the drug results in loss of action. You are prophylactically treating an 84-year-old man with amantadine and vaccination for avoidance of an upcoming influenza outbreak. The patient is to receive 100 mg BID for 8 days. What is the antiviral effect of amantadine? A. Amantadine binds to the hydrophobic sites on the influenza virus capsule. This destabilizes the virus, not allowing it to attach to the cell. B. Amantadine serves as a captive viral mRNA and prevents binding of reverse transcriptase. C. Amantadine binds to ICAM1, preventing viral attachment. D. Amantadine is phosphorylated by viral thymidine kinase and used as a defective guanosine analog in viral DNA synthesis. E. Amantadine prevents viral uncoating and inhibits production of viral mRNA. The answer is E. Amantadine prevents viral uncoating and inhibits production of viral mRNA. Amantadine only works after viral attachment to the cell, preventing viral uncoating. It is also believed to interfere with viral mRNA production. Amantadine is effective against influenza virus A. A patient comes to your office with a severe eye infection. You prescribe eye drops containing a mixture of the antibiotics gramicidin, neomycin, and polymyxin B. What does the mechanism by which neomycin acts as an antibacterial agent involve? A. Inhibiting protein synthesis. B. Inhibiting DNA replication. C. Stimulating translation. D. Preventing cell wall synthesis. E. Forming a channel in the membrane. The answer is A. Inhibiting protein synthesis. Neomycin belongs to the aminoglycoside antibiotics. They act by inhibiting the 30S subunit in protein synthesis. Neomycin, when given orally, is not absorbed from the gastrointestinal tract and has been used as a preventive measure for hepatic encephalopathy and hypercholesterolemia. By killing bacteria in the intestinal tract, it keeps ammonia levels low and prevents hepatic encephalopathy, especially prior to GI surgery. It works as an antibiotic that is active against streptomycin-resistant bacteria, including in the case of tuberculosis organisms. It has also been used to treat small intestinal bacterial overgrowth. It is not given via injection, as neomycin is extremely nephrotoxic even when compared to other aminoglycosides. The exception is when neomycin is included, in very small quantities, as a preservative in some vaccines, typically 25 micrograms per dose. Which of the following is a common feature of the antiviral action of AZT and acyclovir compounds? A. Must be activated by host cell enzymes to be effective. B. Act by alkylating viral DNA. C. Block virus from entering cells. D. Are active in the unphosphorylated form. E. Are analogues of purine nucleotides. The answer is A. Must be activated by host cell enzymes to be effective. 3-azido-3-deoxythymidine, AZT, is a nucleoside analog that blocks HIV replication by inhibiting the RNA-dependent polymerase, HIV DNA polymerase. The DNA polymerase from HIV is 100-fold more sensitive to AZT than the host polymerase. AZT is a pyrimidine analog that is phosphorylated to AZT triphosphate bicellular enzymes and acts as a competitive inhibitor of the reverse transcriptase. AZT can be incorporated into viral DNA and cause chain termination because its structure lacks the 2-hydroxyl needed for addition of the next nucleotide by the polymerase. In addition to nucleoside analogs, HAART, highly active antiretroviral therapy, also contains non-nucleoside reverse transcriptase inhibitors and protease inhibitors that block cleavage of the precursors of the viral coat proteins, preventing proper viral assembly. Maraviroc blocks a specific cell receptor needed by HIV to enter the host cell. A 32-year-old female presents to your clinic with recurrent bacterial cystitis. You culture Proteus sp. from the bladder and start her on amikacin. She presents 1 week later, with no improvement. Resistance to amikacin can occur by several methods. Which one of the following methods best describes a mechanism in which an organism can become resistant to amikacin? A. Decrease in solubility in the bacterial cell membrane. B. Enzymatic hydrolysis by beta-lactamase producing bacteria. C. Inactivation of amikacin by bacterial acetylation. D. Loss of the receptor on the 50S ribosomal subunit. E. Degradation of amycin by bacterial peroxidase. The answer is C. Inactivation of amycin by bacterial acetylation. Amycin binds to the 30S ribosomal subunit, not the 50S. Enzymatic hydrolysis by beta-lactamase producing bacteria targets penicillins. Bacterial resistance to amycin can be mediated through loss of a receptor by which amycin binds the 30S ribosomal subunit, interference with membrane transport, and bacterial acetylation, adenylation, or phosphorylation. Amycin is resistant to peroxidase. Amycin is only marginally soluble in the bacterial cell membrane to begin with. Which of the following antifungal agents interacts with cytochrome P450-dependent sterol 14 demethylase to inhibit ergosterol synthesis in many fungal organisms, as well as in gram-positive bacteria and protozoans? A. Ketoconazole. B. Amphotericin B. C. Flucytosine. D. Zidovudine. E. Grisiofulvine. The answer is A. Ketoconazole. The mechanism of amphotericin B involves ergosterol, but the mechanism is not related to ergosterol synthesis. Amphotericin B binds to ergosterol in the cell membrane, disrupting its permeability to ions. Ketoconazole and other imidazoles interact with cytochrome P450 to inhibit P450-dependent synthesis of ergosterol by sterol 14 demethylase. Grisiofulvine interacts with microtubular protein to inhibit fungal mitosis. Flucytosine incorporates into RNA and disrupts fungal protein synthesis. Zidovudine is used primarily as an antibiotic and not as an antifungal agent. Antibiotics that inhibit bacterial cell wall synthesis include which of the following? A. Quinolones. B. Aminoglycosides. C. Tetracyclines. D. Sulfonamides. E. Vancomycin. The answer is E. Vancomycin. Vancomycin is the correct answer. Antibiotics that inhibit bacterial cell wall synthesis include the beta-lactam antibiotics, penicillins and cephalosporins, vancomycin, and bacitracin. Which is a glycoprotein, produced by many mammalian cells, and used in the treatment of hepatitis, papillomaviruses, hairy cell leukemia and AIDS-related Kaposi's sarcoma? A. Acyclovir. B. Zalcitabine. C. Eyedrops. D. Interferon. E. Zidovudine. The answer is D. Interferon. All the listed agents are synthetic analogues, except interferon, which is a glycoprotein produced by many types of mammalian cells. It has been shown to be useful in treatment of hepatitis, papillomaviruses, hairy cell leukemia and AIDS-related Kaposi's sarcoma. Eyedrops, as its name implies, is a synthetic pyrimidine analog, which inhibits viral DNA polymerase. Zidovudine and zalcitabine are also synthetic pyrimidine analogues, but they inhibit reverse transcriptase and act as chain terminators. Acyclovir is a synthetic purine analog which requires viral thymidine kinase to be converted to an active phosphorylated form, which then inhibits viral DNA polymerase. Certain helminthic infestations can spread to the CNS. Pretreatment with which class of drugs is required prior to diethylcarbamazine administration? A. Diuretics. B. Antiviral drugs. C. Anticoagulants. D. Opiates. E. Steroids. The answer is E. Steroids. LoLo is an extraintestinal nematode, which may migrate to the CNS, causing encephalitis. Diethylcarbamazine is successful in treating LoLo but will exacerbate the encephalitis unless steroids are used first to treat the symptoms of the encephalitis. Other side effects of diethylcarbamazine may be due to rapid death of nematodes and release of various toxic substances. Symptomatic treatment might be appropriate with a number of pharmacological classes, but most symptoms will resolve as the body is cleared of dead and dying nematodes. A 52-year-old man presents with a 3-day history of persistent diarrhea, having up to 7 watery bowel movements without bleeding a day. He has associated lower abdominal cramping and notes mild nausea. He denies travel outside of the country. He does not recall eating anything unusual, and none of his family members are sick. Past medical history is significant for GERD, for which he takes Protonix daily. He recently had an upper respiratory infection and completed a course of oral levofloxacin approximately 3 weeks ago. A stool sample is obtained. Stool is negative for ova and parasites, but PCR testing is positive for Clostridium difficile. What is the appropriate first-line treatment in this patient? A. Metronidazole. B. Prednisone. C. Clindamycin. D. Loperamide. E. Lamotrigine. The answer is A. Metronidazole. The patient is infected with Clostridium difficile, a gram-positive, spore-forming bacillus. It is manifested by watery diarrhea, which left untreated can progress to fulminant colitis. Previous antibiotic use is the leading cause of Clostridium difficile, as the use of antibiotics alters the normal colonic flora, allowing Clostridium difficile to proliferate. Patients who have confirmed infection should first discontinue any offending antibiotics. The patient is then treated with either oral metronidazole or oral vancomycin. Due to its cost, oral vancomycin is typically reserved for severe or recurrent cases of Clostridium difficile.